Ban pinbiang ye kijaka ajing sumar na kabanta kipat ba kibapang basitom hakasni palai jang katayo umentirang ba kajala ukonrat kisangma ula play ya ka Rural Health Center hakashnong Myriaw kabadon ha Eastern West Khasi Hills District.
Hagani kajing play kani kijaka ajing sumar ka Rural Health Center. Ledan lang Menteri Ketenat Sports and Youth Affairs ubak Syakliar Warjeri, UMP ke Raja Sabha Dr. W.R. Karluki kihek nak ketenat kakoi kakia berkibai-kibai. Yakni ke Rural Health Center lebih tingkat daka CMSDF ha kajing lut ke belakot syakalai kupra poin pralak tengkah. Bagan ajing syakri ki arpuai teligisnong, bad yakni ke Rural Health Center en penyat daka Dr. H. Gordon Roberts Hospital Shillong. Habakran na kajing yalang ukonrat kongkal sangma ulong bagi gam kebedai bakakot kakya kedai kebabon bah kajing tenjo akajelah. Habakadaw ya kajing kelak belawan ra kajing tay kajaka sumar hai kini kinyo senam ban penklan kajaka sumar na kabantagi nong syok shnong basa syakijaka kibakan dong tam jo kajelah.
Friends, health sector has been one of the most challenging sectors for us as a government and as a society. In the last 7 years, our government has taken number of steps to bring reformation to the health sector. I'm happy to inform you that our government spends 9% of its budget on health sector. To give it in perspective of the nation, the Meghalaya government is the highest spender in terms of percentage of the budget in the entire country. So 9% is what we spend, which is the highest compared to any other state in the country.